Hello, web shadowers. Thank you all for attending our session this afternoon.
Today we have the pleasure of hosting Dr. Ho, who will be teaching us all about facial and reconstructive plastic surgery.
As always, please remember that the Google form will be posted in the chat box and in the description of this video at the end.
So with that being said, Dr. Ho, you may begin whenever you are ready.
Okay, great. Hi, thanks so much for having me. Sorry, this is just a little bit impromptu format. I had to pursue my own self-care today with a dental appointment. But anyways, just to introduce myself, I'm Tina Ho. I'm a facial plastic surgeon in the Philadelphia area and currently in private practice. And as a facial plastic surgeon, I specialize in both cosmetic and reconstructive procedures of the face. I ultimately first did ENT, ear, nose, and throat residency training for 5 years, and then followed by a fellowship, 1 year fellowship in facial plastic and reconstructive surgery. My own career aspirations and interest in surgery started actually with my own childhood reconstructive surgery experiences. I was born with a large nevus, think like a large mole in my forehead, and that required removal early on, and several reconstructive surgeries, just that it could have been potentially cancerous later on. With these reconstructive surgeries, and a lot of them actually occurred at CHOP in Philadelphia, I then saw the positive immediate impact that my own childhood surgeons had on me. And I wanted to be in a similar role for my own patients, to have that decisive role in healthcare. Ultimately, really enjoyed pursuing health sciences, math and science classes. I went to the College of William and Mary for undergrad, majored in both neuroscience and international relations. And then through college, that was where I also found a passion for service too. Went on a couple of medical mission trips, even if they were primary care oriented. Really enjoyed them. I really encourage those of you who are in college to pursue those opportunities, not only from a medicine standpoint, but also to widen your perspective and be able to see and experience another culture and appreciate more what you have here as an American. And then ultimately went to University of Virginia for medical school. So I was in state for both college and medical school. Going in, I was interested in plastic surgery, but really tried to stay open-minded as much as possible. And I really strongly recommend that, whether you're considering medicine versus another career path, versus surgery or non-surgery in medicine. So, and at UVA, I, didn't know about ENT, ear, nose, and throat otolaryngology until I was in medical school. General surgery was my favorite core rotation in third year. And then I did pursue a couple surgical subspecialty rotations, plastic surgery, meaning body plastics and general plastic surgery. So you learn plastic surgery for the entire body versus ENT. And what I realized with ENT, and it was a better fit for me, I liked being like a focus specialist, just a head and neck specialist. The anatomy to me was really cool. The cranial nerves, the small blood vessels, how intricate the anatomy was really appealing to me. And then also my mentors, the residents and attendings who I worked with, I feel like I clicked more personality wise. They all seem super smart, but also very balanced too, in terms of their work-life balance, and really approachable. And then I additionally learned that within ENT, there's subspecialties within it, like, rhinology. A lot of it is skull-based, sinus surgery, otology, focusing on ear, skull-based disorders, laryngology, voice disorders, pediatric ENT, and then there's facial plastic and reconstructive surgery within ENT. So that I saw that there was a pathway or niche to pursuing plastics, so that I thought was really cool. So ultimately, I ended up applying to ENT for residency and was lucky to match. I ended up in the Midwest at University of Kansas Medical Center. Within ENT, a lot of the big programs are actually the Midwest, kind of as they're like the one program in a large city, across covering a large geographic area. And there I really had a great clinical training. I was well-rounded, not only for ENT, but for facial plastic surgery. Bye. So I tried to, again, be as open-minded as much as possible in the process, and still wants to be a well-rounded ENT surgeon. And ultimately, facial plastics was still my calling. With facial plastics, and I think it's interesting when you decide what medical specialty you want to pursue, it may not be just because of the the niche of medicine that you're most interested in, but also whether that niche suits certain personality traits of yours. So with facial plastics, for instance, as a surgeon, I like being decisive, having an immediate impact with my patients, being able to work with my hands. I think those are really essential. I also tend to be impatient too, at the at other end of the spectrum. I'm also detail oriented, meticulous. I'm a perfectionist. I think that goes hand in hand with being a plastic surgeon. Are super smart, but they're great at being able to be in a dark room, all day and look at imaging. Emergency medicine doctors, I feel like they have it all, where they, know patients the same. They have a good mix. They're able to, turn things off when they go home. It's nice for them where they have shift work. So after University of Kansas, that was 5 years of residency. That was followed by 1 year of fellowship in Chicago. It was through University of Illinois, Chicago. But it was in a private practice setting. Two of the offices I mainly worked at were off Michigan Avenue. And then ultimately, my parents, my family are still in DC suburbs of Virginia. We grew up a little bit in the suburbs of Philadelphia. So when I was applying for jobs, it took me back east to be in private practice in the Philadelphia area. Right now, I'm in private practice. I mainly do cosmetic work. I do miss the reconstructive side a lot. It's just how my pathway has taken me so far. And, as someone in private practice, I'm young. I'm only a couple years in, so I'm right now still building my practice. And so trying to hustle in terms of recruiting surgical patients and there's a lot of variety within it. So someone who trains in facial plastic surgery, whether in private practice or academics, or how they've tailored their practice, can be different from other facial plastic surgeons, in this arena. From a reconstructive side, we can cover facial trauma. So think patients who, broken bones in their face due to like car accidents or being in a fight. That could be like a nasal bone fracture, a jaw fracture, cuts on the face. Also reconstructive, we perform Mohs reconstruction or skin cancer reconstruction as well. Most surgeons are dermatologist surgeons that take out the skin cancer in pieces, and they kind of assess in under the microscope and try to create the smallest defect possible after taking out the skin cancer. If they don't feel comfortable removing that skin cancer because it's a little bit too big or in a sensitive area, then they could ask a facial plastic surgeon or a plastic surgeon to become involved with the repair. Also, much bigger skin cancer defects. Say it's a patient with big history of smoking or alcohol use who has a large cancer of their tongue. It's a cancer that can be removed by one of my colleagues, a head and neck oncology surgeon who's ENT trained, and then that defect can be repaired by them, or again, a plastic surgeon, a facial plastic surgeon. We call it free flap surgery, where you can take a tissue from the arm or leg and you reconnect it to the local wound bed with like you have to reconnect arteries and veins too. It's a really cool surgery. In reconstructive, there's also congenital conditions that facial plastic surgeons can help address, like cleft lip, cleft palate, vascular lesions like hemangiomas. And just note, there is some overlap when it comes to plastics like facial plastic surgeons versus plastic surgeons, like general plastic surgeons or body plastic surgeons, as well as oculoplastic surgeons. Oculoplastic surgeons, they train as ophthalmologists first, and then they can do reconstructive and cosmetic surgery around the eyes. Some do specialize more to do procedures like facelifts. If you train in general plastic surgery first, usually if you go straight through, it's a 6-year program, and then you go into private practice, or you can specialize more like a craniofacial fellowship. Some conditions like cleft lip, cleft palate are historically covered by plastic surgeons in the country. There are talks in the country where facial plastic surgeons do facial conditions. It might be easier to establish that niche and go the plastic surgery route. Some of the things under plastic surgery that I wasn't as interested in, that's why it steered me towards ENT facial plastics. That includes wound management like ulcers, hand surgery, just never had an interest as much. And then too, like covering a lot of more body surgery like breast surgery, abdominal surgery, that just didn't appeal to me as much as surgery of the face. And then also in the reconstructive realm of facial plastic surgery is facial paralysis, like facial reanimation. So there's non-surgical and surgical treatments that can be done to help restore asymmetry of the face and even restore some motor function to the face. Now on the cosmetic side, you have rhinoplasty under facial plastic surgery. This can be performed from a functional or cosmetic standpoint. As an ENT surgeon trained first, I feel privileged to really understand both form and function when it comes to the nose. So I want to make sure when I do a rhinoplasty, even if it's for cosmetic purposes, that I need to perform it to preserve the nasal area, make sure the patient is breathing just as well, if not better, after surgery. So rhinoplasty, it's a great procedure. It's one of my favorite. Of course, it's one of the most challenging in plastic surgery, because even a millimeter change can make a big difference in the face. So it's one that's very delicate, requires a mathematical basis and appreciation for the proportions of the nose compared to the face, as well as an artistic intuition of how to create aesthetically pleasing noses. And then in the cosmetic realm, there's additionally aging face surgery, which I could do a good amount of work. And so that includes facelift, neck lift, eyelid surgery, brow lift. And then my younger patients, a lot of them want to, pursue more youthful, defined, or more feminine or masculine faces as well. So they could, pursue procedures such as liposuction under the chin, buccal fat removal, chin or other facial implants to achieve more definition that they are seeking. Also, in terms of cosmetics, I don't cover this aspect of facial plastics, but transgender affirmation surgery or facial feminization surgery is big or rising in facial plastics. And then the whole non-surgical side continues to be increasing among patients. I do a lot of Botox and filler injections for facial rejuvenation or help with facial asymmetry as well. And then there's skin rejuvenation. Depends on your niche and what you want to do, but lasers, I perform CO2 laser, not as much as some of the other lasers. And this is an arena, the non-surgical, that can have an overlap with cosmetic dermatologists, as well as I mentioned my other, plastic, facial plastics, and my, niche so far in private practice. And a little bit here, I'm going to, review a couple cases of what I, kind of more of what I do kind of day to day. Let me review, I guess a lot of times students like to ask, what is your typical schedule like, day to day or during the week? I'm also a new surgeon mom. My son is close to 14 months now. So I'm also happy to help answer questions related to the perspective of a female surgeon and as well as a parent surgeon. It's something that I navigate and take it day by day. It's both rewarding, professionally and personal, but it's challenging too. Trying to the struggle of trying to find a balance from time to time. For me, as a surgeon in private practice, and I mainly see elective patients, there's a lot of pluses there in terms of work-life balance. I'm in clinic, about 3 days a week. The hours are either 8 or 9 to 5. For me, I'm not like some of my other colleagues, especially in primary care, practice who are seeing 30 to 40 patients. It could be 5 patients, it could be 10, depending on what's procedural. Again, I see a lot of injectables like Botox filler. I'll see non-surgical consult patients, surgical consult patients, see patients for preoperative visits, those who are preparing for surgery, as well as post-operative visits, those who are recovering from surgery, and also can do some in-office procedures in the office on these days in the clinic. That includes like eyelid surgery, chin liposuction, buccal fat removal. Then about 1 to 2 other days of the week, and again, my practice is still building. I'm hoping to be operating 2 to 3 days a week. I'm at the surgery center. Usually, case may start at 7:30 in the morning, and I can be done by 3 or 4. Depends on the case. If it's like eyelid surgery, it may take an hour. If it's like a bigger aging phase surgery, it could take all day, 4 hours, 6 hours, 8 hours, depending on what the patient needs. And just think too, even if these are the hours where I'm seeing patients, as a physician, the distinction between when you're on and off, especially in my experience, it doesn't come like that. I have to take time to answer patient phone calls and emails and finish on my notes. A lot of times I try to do that while I'm work so I can separate more work from home. Sometimes, depending if I'm running behind, I need to get home sooner, I might have to bring homework and finish it there. Something else that I was going to mention, and then furthermore, about 1 day a week, I'm working from home. And this is the side of medicine that especially, I didn't learn myself in my training, and it's more related to private practice, especially in the plastic surgery world, but to work on the admin things, again, it's not bringing you in revenue or having you see patients, but things like marketing, for instance, my Instagram, my websites, and again, working on leads and doing things to better my practice. Those are things that I'm really working on. Other considerations when it comes to private practice, and I'm happy to help answer more questions, kind of distinction of private practice versus academics. I myself had applied to some academic jobs right after or during fellowship, and just with facial plastics, there's not many positions open, so it was hard to find that opportunity from fellowship. With academics, you have the opportunity to engage in research and teach residents, and those are definitely really rewarding. Also in academics, you're closer to what is kind of more new and novel in facial plastic surgery or other fields, and able to collaborate with colleagues in with difficult cases. With academics and or working in a larger hospital system, you may likely have less autonomy. You can be in a bigger call pool, but when you're on call, you're seeing sicker patients. You may have residents cover for you. So there's pluses and minuses there. You're kind of more under a system of what your bosses ask of you. So again, less autonomy, and also potentially less opportunity for increased pay or promotion. On the other side, with private practice, you can have more autonomy in terms of figuring out your schedule, more opportunity to be able to make more, but at the same time, more responsibility. So you can think about if you have employees, hiring, firing can be a big deal. When you take time off, it's not as protected. You're not, you have to figure out who's covering for you, and you're not making money, but potentially losing money because you need to have your office potentially open. But from a call standpoint, like for instance, me, I don't need to run the hospital. I don't work on the weekends unless there's an emergency. I just currently take call for my patients. So it's nice from a work-life balance. Okay, so let me just hop on here. I'm here on my computer. And thanks for bearing with me. Hopefully this has been working out okay. You guys have been able to hear me okay here. Perfect. Okay, so I'm going to leave here. Yep.
Hello, Dr. Ho.
Hi, let me see here. I'm going to start the video. Okay, am I streaming again?
Yeah.
Okay. Okay, perfect. Okay, so just give me one moment. I'm going to just get on a folder here to access this one patient. And then I'm going to go, so for me, cases, it's basically from before and after perspective. So is this a good opportunity where if I go through this case to ask for participants to answer, or do you want me just to go through this case? How's the best way to go about it?
That would be great if you can ask for them to answer.
Okay.
Zoom does delay the comments though for about like 45 seconds. So if we're not sending something right away, that's why.
Okay. Sounds good. Thanks for. Okay. Okay. And then, so I'm going to share my screen here. Okay, perfect. Are you all able to see this?
Yes, we are.
Okay, great. So this is a lovely 50-year-old, female patient who came to me, was concerned about basically signs of aging in her face. So the left picture is her before, and the right picture is her after. So, if I could have some comments here, what do you think that she's had done? And let me see here. I don't know if I can see the chat or not. I'm just trying to think.
It should be under more. If you click more, it should show up a chat box.
Under more.
Yeah.
Let's see here. Oh, okay. Okay, good. We got some great answers here. Okay. Great answers. Okay. So basically to walk you through her, so you guys have said a lot of the correct answers. So she did have some non-surgical work done, some injectables. I'm going to first focus on the one surgical procedure that provided some nice improvement. So as we get older, the eyes usually show the first signs of aging. So you think of the upper and lower eyelids. They can become more redundant, like heavier appearing. The brows can start to sag, and then the lower eyelids too. Besides the increased laxity in the skin, some patients can have puffiness in like eye bags and lower eyelids. That's usually due to fat that's herniating through, and then as well as wrinkle lines. We call it the crow's feet around the eye. So looking at her on the left, you can see just the heaviness of the upper eyelid tissue, kind of even encroaching on her eye aperture bilaterally, and just with that one small surgical procedure, she, her eyes just pop more. The heaviness is taken away. She looks more refreshed. She looks great. She did have a couple of non-surgical procedures as well. Again, just so that I'm not saying that all the changes that we're seeing are due to, just one eyelid procedure. I like to pride myself on beautiful natural results where, you can maybe see that something is different, but not necessarily tell what's been done. Because I think it's fun in a way as a surgeon, kind of the ultimate compliment where someone looks refreshed, but a friend or family member knows, but when they say, "Oh, did you get your hair cut or go on vacation?" To me, that's the ultimate compliment as a surgeon. And then so for her too, what she had done, she had some cheek filler. So I love rejuvenating the mid face because again, with you think of the ideal youthful face, especially a female one, good cheek projection, volume, kind of the V-shaped inverted V like contour or inverted pyramid contour. So if we can address the cheeks, restore some projection definition that lifts the face up, even takes the tension away from the lower part of the face. So in her mid face here, I did some cheek filler. I also did some lip filler as well and some Botox, but you can't really tell since it's a static picture of how minimized the lines are. So she actually ended up becoming a reconstructive case as well, which was interesting. So I saw her at a week out. That's when stitches come out from the eyelids. She was doing well. And then 2 days after, she calls me late at night saying she was the ER. Her dog accidentally jumped up and, bit her in the nose and eyelid area. So let's see here. See this will. So, she's waiting for the ER physician, and then I ultimately, decided to see her in the office to just take a look and see, what I could do to help. Ideally, with a facial laceration or trauma, from an infection standpoint, you want to repair any cuts in the face 4 to 6 hours out within that time, to optimize healing and minimize any infection issues. So you can see her on the left eyelid. She has some cuts, along the bridge of her nose by the corner, the middle corner of the eyelid. And then lucky for her, this looks worse than it was, but her left eyelid incision just opened up. It didn't, the dog didn't, avulse or take out tissue, luckily, because that would have been a much more challenging reconstructive pair. Might have to think about a skin graft and such. So what I did was I cleaned this out as best I could and then just sewed all these cuts together as best I could. And here on the right, again, is where she's 6 months out from her original surgery, which it's amazing how well the face heals, that she looks as if you would have never known, that she had this history of trauma too, pretty soon after her surgery. I'm going to show you just a couple learning points of things that happened to her while she was healing from the trauma. I consulted with colleagues about it, and especially as a young surgeon where you're wondering, what else should I do in the immediate interval? There's something else that maybe that can be done, but sometimes the best thing to learn over time is to be able just to be patient and vigilant and let the patient heal, and give that reassurance to the patient too. I have one question. Average, how long does it take to heal from procedures like that? So from any surgery, if it's more minimal, I wouldn't say minimal, more like a focused procedure, like an eyelid surgery, uh, a lot of the bruising and swelling comes down within 2 weeks, and you may see results as soon as then or within 4 weeks, but really you give any scars at least 6 to 12 months for the final results. For a facelift or a neck lift, you may
look pretty good at 1 month out. It just may take longer to heal. For injectable procedures, you may have some initial swelling within 1 to 2 days after the procedure. Botox, you will see the final result at about 2 weeks out. Filler, you'll see an immediate result, but with any swelling and letting the product settle, give it at least 2 weeks as well. This picture shows with her eyes closed, you can see the redundant tissue on the left side of her eyelids, and then after, how faint and minimal the scars are in her upper eyelids. So she's healed really nicely. And I want to show you, okay, so a couple of things. This is her, she's probably at 2 to 4 weeks, I think a month out from, the surgery and then the trauma repair. A couple of things that I noticed that I was, a bit concerned about with her left eye. One was right here, in the corner, she developed some webbing, like the scar became much more prominent. And, this is something that can happen in an area because especially with the lacerations there, and you're thinking, this is a concave area. Sometimes it can sit flat, but sometimes it's just prone to webbing. So we just watch this over time, and luckily just with some massaging, some ointment, steroid ointment, it went down. So it didn't need to be revised. It didn't need a steroid injection. But it was something I definitely consulted colleagues to make sure, hey, is there anything else I should be doing? The other thing I noticed with her left upper eyelids, she looked like what she had developed an eyelid ptosis. Ptosis meaning where the eye aperture is smaller. See how that upper lid is coming down more and it's encroaching upon the pupil. This is something I was concerned about. Luckily, I went back and looked at my original immediate post-op pictures from the eyelid surgery and saw that it wasn't associated with my eyelid surgery. My colleagues also reassured me it's probably just with the swelling and healing the trauma from the laceration over her eyelid, and it did resolve with time, which is great. Also, I want to acknowledge eyelid ptosis is a condition that can be repaired with eyelid surgery as well. I don't perform this procedure just because I'm not trained as an eye surgeon first. So if a patient, you have to make sure it's not just the heaviness of their tissues, if there's, other things that they, other issues that they may have or don't have. But if she had this, at rest, I might have said it might be best for you to see an oculoplastics or eye surgeon who can take care of both the ptosis and the heaviness of the brows. And it can also be covered by insurance too. Then I'm just going to show you kind of a series of other pictures here. This is her at 1 week out from the initial eyelid surgery. Again, patients from eyelid surgery look worse than they are just because it's not too painful, but the eyelid tissue is very thin and delicate. And so, it's prone to a lot of bruising and swelling, like I punched you in the eyes the first couple of weeks. This is from her laceration repair about a week out. Okay, let me see here. And then just these are some other side views, different views. So you can kind of just take a look at her eyelids of the before and after. I'll just go through just from a cosmetic standpoint that you can see that heaviness is, lifted a bit from the eyes. Let me just see here. So you see, yep, and especially here, kind of here, coming here. And again, it's natural. It's not super drastic. You don't want to take out too much tissue and cause an overdone result as well. Okay, and then so this patient, so I'm going to show you another picture of her. So she, after all we've been through with first eyelid surgery and then facial laceration repair, she actually was interested in pursuing more treatments with me. This happened last fall. So I have some now additional after pictures, and we'll leave it up to you all to guess. And just if you guys can, just don't look at the file name as I kind of scroll through. I'm kind of realizing that real quick, if you guys can just turn away. Okay, let's see here. Okay, can you all see this, hopefully? On the screen share? Okay, so why don't you now all tell me what she has additionally had done? And then I will kind of show you some other images of her. But again, try not to look at the file name as I'm showing some additional views. We have this one here. Sorry, I'm still pretty Mac illiterate, so I am
we're only able to see the other lady's picture. I think you have to share
Okay.
the other desktop.
Okay, let's see here. So sorry, someone said yes, so I was share screen. Okay, thank you. Okay, so we have her here. Okay, and then since I can't really scroll through, just disregard the file. Let's see here, I'm gonna upload one more here. Let's see here. Okay, can you guys see this view?
Yes, we can. Thank you.
Okay, great. Okay, so I'll just show those two views because I think it just keeps logging me out here. Okay, so any guesses on what else has she had done based on those two views? Okay, interesting. Good. Okay, so now we're gonna go over the okay, so I'm gonna basically focus on here, and someone was on the right track. So I did a lower facelift and neck lift. So you can see she now, and it's, we agreed on two. She has the neck that she never had. I'll try to show one more time the front view, but this is where by lifting all that tissue, and I did some deep sculpting as well. You see here, even from a genetic standpoint, even though aging does make things more lax, sagging, causes some people to have more fullness in the neck. Some patients too, from a genetic standpoint, always have had a heavier, face and neck. So I basically made incisions, along here, along the tragus to the ear, and then they go behind the ear into the hairline. She's healed really well. That it's a bit tough to see where you can see the incisions, but she's a much nicer neck contour. And then I'm going to share again. Let's see here. I'm going to share one more time. Here, so you can see on the front, so you can actually see more the shape of her face as well, with it's lifted, and all the heaviness here in her neck has been taken away. So it's just taken a lot of time off her face. You can see that we're focusing more on her eyes now. With the previous eyelid surgery, her eyes pop even more. She just looks a lot more fresh, and we've been really happy with her results. So okay, well, thank you so much for, tuning in. My apologies for spending a little bit longer than expected, just going over the case and then talking about my practice. But I'd like to, open this up for questions. And let me know if there's somewhere where I should be checking for, okay, can you talk more about the training goes and actually practicing these skills for the first time? That's a really good question. So, I have patients who ask me every day, how many procedures you've done, how long have you been in practice, especially patients who are in their 40s, 50s, 60s, 70s, and they're much older than me. I look young and I am young to them. For me, especially when it comes into cosmetic, there's not as much opportunity to quote practice or do procedures in patients because these patients are paying. It's different. Like say if when you go through medical training and you're operating at an academic center or at the VA and you're doing medical treatments and surgeries where you're able to be involved more, that there's more opportunity for that because these patients are getting procedures done from a medical standpoint. So a lot of my fellowship was assisting. I did that in residency too. So I can tell patients, I've assisted, I'm very experienced on, hundreds and hundreds of procedures. I myself as a fellow did get to do some surgeries on my own, as well as did Botox and injectables, which I think helped me to have, a starting basis, especially for patient reviews and before and afters, to get that foundation and some confidence. And then a lot of it is to kind of rely on your skill set and be able to, win patients over for them to trust their face in you. What other questions are there? I don't know if there's like a list. What techniques have helped you in achieving symmetrical results? That's a good question. So interesting enough, and maybe y'all should take a look in the mirror for yourself, but we all may have some inherent asymmetries to our face, whether they're very subtle or they can be major. I think if someone doesn't have gross asymmetry, you always want to have your before pictures, for objective comparison, not only for you, what's a surgery or non-surgical procedure to make sure that you are, assessing the patient correctly. You can refer to them as you're going through a procedure, especially a surgery, but also as an objective, foundation between you and the patient to show them, especially whether you can show them the result that you've got or that you maintained asymmetry, or for their protection too, that if they didn't see enough, if they see an issue, or if they see a new asymmetry. When you perform a surgery like so it's eyelid surgery or a facelift, I do, besides looking at the before pictures, I do also a lot of assessment, like looking from left to right. You do one side first and then you compare the other side. Whatever, take out as much tissue, suspend as enough as what you needed. What has been your most memorable case? That's a good question. I feel like, let's see here, most memorable. I think this one patient that I presented, she's very memorable to me. She's been a great patient and very loyal and able to trust her face with me. It's nice to have a progression where I first saw her for Botox and she complained that her brow was too heavy, from another injector. And then I mentioned to her gently, like, you could benefit from eyelid surgery, so you may not be as reliant on that Botox. And so she proceeded with the Botox, and then she had the laceration issue that we helped take care of. And then she came back to me and said, I want to do more for my lower face. She first was interested in liposuction. I mentioned to her that it would, she'd actually most benefit from a facelift and neck lift, and she took the plunge. And so, ultimately we were able to achieve the best results for her. What made it motivated you to start your own practice? I think basically it's just been based on the opportunities out there and what has kind of steered me in certain directions of what has worked best for me. So, right now I'm actually looking for my own space. We'll see how that goes. But I think to be able to be my own boss, have some more autonomy, and really to focus on taking care of my patients, just like how you all go through school and such, there's ups and downs, no job or, no one's life is perfect. But that's the reasoning right now. It's not like I necessarily want to, try to make more money or protect my time so much. I think it's just that autonomy, independence is what I'm looking for. Why did you choose plastic surgery? As I mentioned at the beginning, I had my own childhood experiences with surgery, reconstructive surgery, that showed me early on the definitive positive impact that my surgeon had on me in the similar role I wanted to be in. As a private practice doctor, are you able to consult with other doctors? Yes, all the time. For me, it's more kind of networking and finding local colleagues who you trust, that you can send for referrals. I too need, working on this, need to network so I can try to ask other doctors to refer to me and vice versa. I think it's been great to have my mentors who are still available via phone, text, or email, and colleagues in the area that not only for consulting but for curbside. You say, hey, I have this complication or I have this question, what are your thoughts? Because I think having that support system, especially when you are on your own, when you're in private practice, without any safety net, is really helpful. Has there been a time where it didn't go as the patient wanted? Definitely. Whether there's times where we have a bump in the road with the healing process with surgery, the more challenging times have actually been when it's been a difficult cosmetic patient and it comes to like a filler result. I've learned myself, not only do you need to make sure objectively that they could benefit from a treatment, but also from an expectation standpoint. So mentally too, that the patient is understanding real expectations, that you feel like you can help achieve what they're doing. Because some patients I've learned, even if you felt like you could help them, no matter what, even if you achieve the perfect result, they may never be happy. So sometimes the hardest thing to do or say, which is what I'm learning right now, is to say no. What is the most challenging thing you encounter in your specialty? I would say the most challenging aspect is the most difficult cosmetic patients. One perspective I learned too is that you definitely a niche or aspect of medicine suits you if you can help take care of the most difficult patient. In my ENT training, for instance, in otology, dizzy patients, they're their most challenging patient, and that's not my cup of tea. But the difficult cosmetic patients, there are days where I say, okay, why am I doing this? But ultimately, I feel like my specialty is still very rewarding. From a recovery standpoint, is it better to do surgeries, non-surgical procedures done simultaneously or sequentially and spread out over several visits? I think it really depends on the patient. I talk with my surgical patients and I would say 50-50, decide whether they want to do everything at once. Like say they want to do their eyelid surgery and facelift and CO2 laser at once, that they only have, it's a lot bigger surgery. You have to recover more, but you only have one period of downtime, and it could be a less cost by bundling the surgeries together, that it's less surgeon fee. Other patients prefer to just do one procedure at a time, even from non-surgical standpoint. I don't want to push patients either. I want to make them feel comfortable. So they may want to do one thing, whether it's just a little Botox or they do their eyelid surgery first so they can see one change and then come back when they're ready for more or based on their downtime. I think from my standpoint, if I were the patient and just seeing what my patients go through, and if they're needing more, whatever, what is a good amount of filler or more extensive work done, I prefer, I'm able to do more in one sitting so that they can see more of a result afterwards. How do you handle patients who are upset by the outcome of a procedure? So, this is a good question. As I mentioned earlier, having those before pictures and taking after pictures is very helpful. So you can set an objective ground to see, okay, whether it's protecting yourself, like we did get this result, we didn't have this issue or complication, you're looking good, or otherwise, it's for the patient too. Say if I cause an issue or they didn't see enough result, then we use that as a measurement. Two, you try to counsel them as much as possible up front so that you can minimize issues. You try to make sure you show that you care and apologize, even if you don't feel like you're as much as in the wrong. They say when it comes to, lawsuits against doctors, not necessarily because of the complications, but a lot of times the breakdown in the communication. And then also it helps too to get someone else involved, like if you're a patient care coordinator or whoever, to as an objective or third party person if needed. Sometimes it's maybe at the end of the day, very rare, but sometimes it's like you just maybe refund the money if it's, even if you don't feel like as much you're in the wrong, just because it's sometimes, you know, it's unfortunate sometimes, but sometimes you may have to feel like you need to do that. Let's see here. How do you deal with a facial tumor in mass cases? Have you encountered some? How are the results? So I definitely did a lot of this more in residency. And now in private practice, I'll take out like small lesions like pilar cysts, moles, and such. And so the head and neck part of ENT is really interesting. Taking out thyroid tumors, parotid glands, head and neck cancers. You a lot of times want to make sure maybe get a little biopsy of the tissue beforehand, so you can expect what this tumor may be, because if it's cancerous versus non-cancerous, it's a different approach. Cancerous, you want to take margins around, like want to take a cuff of normal tissue to make sure that you've got enough tissue. And then you have to make sure, based on your imaging and your exam, are these tumors near vital structures like nerves or arteries, that you have to then carefully peel the tumors off. So sometimes it involves a lot of planning, which is needed. Do you think it is becoming harder for doctors to open a private practice now because of the consolidation of hospitals? Yeah, I've seen in other fields, particularly general ENTs, that they're being bought up by bigger hospital systems and such. And two, with the the minuses of running your own practice, whether it's the overhead costs and hiring, firing employees, and what health insurance reimburse. Some doctors have become aggravated. I think with plastic surgery, if you are mostly doing cosmetic, it's better from a payment compensation standpoint and an autonomy standpoint to be on your own. I often see botched jobs from plastic surgeons on social media. Are there any protections for you from a lawsuit if this were to happen? So, all the surgeons should have malpractice insurance, so that helps, if you had to settle something or a patient won a case, to have, to be supported in that aspect. Otherwise, you get your lawyers involved, but you try to think about the steps. Again, and someone asked a good question of, when patients are unhappy, what you do. A lot of it is like you try as much as you can, before something happens and when it happens, to take the time to talk to the patient, apologize if needed, try to make amends, try to just communicate as best as possible, because a lot of times that may be a source of why a patient is so unhappy and wants to pursue a lawsuit. Have you been presented with a situation in which a patient's partner is pushing for them to get a procedure? How would you respond to that? That's interesting. So usually patients come to me that they want something, but sometimes they'll mention, oh, it's because my aunt or someone said this. And I have to take it back and say, what do you want? Because again, it's their face. Or even if they say, what do you think I should have done? And I try not to, it's one thing if they are very open and it's an aging, realistic, and it's aging face patient, this is what I recommend, A, B, and C, these procedures. But if it's something where, say it's their nose, and they want just like the bump shaved down, but then they ask me, they're not bothered by the tip, and they ask me, should they do anything? I recently had this conversation with a patient, and I said, if you're not bothered by it, I don't want to change it, because again, a millimeter change or less can make a big difference. And if you change something that wasn't bothering the patient before, think of the potential issues that you could do cause later. So sometimes less is more, in terms of and I would too. I would want to make sure it's the patient wanting, because they're the ones consenting for the procedure. They're the ones who have to live with the results. So I would, in my mind, try to isolate the patient away from the person who is trying to encourage the procedure. What are things people should be looking for when looking for a plastic surgeon? So I think it's always good to, look at their medical background, their training, just to see that they're, whether they're fellowship trained or board certified or not, or just legitimate enough in that sense. I think a lot of plastic surgeons should hopefully have some before and after pictures, so you can see examples of the results, and also for them to list the procedures that they actually perform. And then at the end of the day, whether you're looking at them at Instagram or once you meet them, I think a lot of it has to come with clicking with your surgeon personally, besides just the recommended surgical approach, and plan, but two, like, do you feel comfortable with them because you're trusting your face in them? For me, I think as a female surgeon, I've had my challenges, and I've seen that we have these obstacles we have to overcome, but I've seen it also as an advantage, because I'm in a male dominated specialty. The majority of our patients are female. So I've had a lot of female patients seek me out because I'm female, including younger ones and Asian female patients too. Have you ever done a double eyelid surgery? Yes. So I've done a number. It's even a more delicate and more difficult surgery, but can be rewarding too. So it's something where I take seriously, and my patients have been fairly happy with the results so far. Okay, so I think maybe this last question here, or let me know. Is it time to? Okay, how long do the procedures generally last as the patient ages? So Botox and filler, Botox lasts on average 3 months, filler lasts like maybe a year or so on average. So it's just those are, you have to keep repeating them. For any aging face surgeries, you're hoping they last 10, 15, 20 years. Something more permanent like a rhinoplasty, it's for life, but the nose changes too over time.
Thank you so much, Dr. Ho, for a wonderful presentation and for answering all of our questions. It was an honor to have you. Thank you.
No worries. Thanks so much for having me again. Sorry again for the weird format today. And then I'm going to leave my Instagram handle and my email address. Yeah. Again, love for you guys to follow and support me. I'm happy to answer any DMs or just to see more what I do. And then I'm going to leave my email address too. Feel free to shoot an email with any questions or anything. But you can see more of my work and the procedure I do on Instagram and also on my website as well.
We'll link it all in the description as well. Everyone, make sure you go follow her. Her Instagram is Dr. Dr. Tina Ho.
Awesome.
Again, thank you so much.
Thanks so much for having me. Appreciate it. Have a good day. Take care.
Thank you. I just
Bye.
posted the link, everyone. So please fill it out within the next 30 minutes. And as soon as the session ends, it will also be in the description of the video. Thank you again for everyone who attended. And thank you again, Dr. Ho.